Welcome to our world.
This is your global.
At this stage in my grief journey, I made a conscious decision to challenge myself to step beyond the boundaries of comfort that grief so often builds around us. Last year, I chose to lean into growth, into purpose, and into possibility. One of the actions I took was to reach out to a concerned NICU mother, an associate and truly remarkable individual, and ask whether she knew of organizations or initiatives aligned with my nonprofit's mission to support children from the womb to the classroom. Through that conversation, I was introduced to Dr. Kanwal G. Singh and the Ink Path organization. Since the latter part of last year, it has been both an honor and a deeply enlightening experience to participate in Ink Coordinating Committee meetings. These engagements have expanded my perspective, strengthened my resolve, and further affirmed the necessity of bridging lived experience with clinical science and the pursuit of equitable care for our most vulnerable populations. As the founder and CEO of S.A.B.R.E.E. Enrichment Academy, as well as a 2026 chairperson of the Global Newborn Society, my work has always been grounded in a dual commitment: advancing educational equity and advocating for maternal, fetal, and infant health. Through my conversations with Dr. Akhil Maheshwari regarding the objectives of the GNS and its engagement with neonatal researchers, clinicians, and global health leaders, I have come to understand and recognize a critical and under-addressed issue within neonatal science, one that sits at the intersection of clinical precision, research integrity, and equity. The lack of standardized laboratory reference ranges in neonatal trials. In neonatal care, laboratory values are not merely numbers. They are the language through which we interpret life, risk, and intervention. Yet, unlike adult populations, where reference ranges are relatively standardized, neonatal laboratory values vary widely across institutions, studies, and geographic regions. This variability is driven by multiple factors: gestational age, birth weight, postnatal age, genetic diversity, environmental influences, and differences in laboratory methodologies. While such complexity is expected, the absence of universally accepted reference ranges introduces significant challenges in both clinical care and research. From a research standpoint, the lack of standardization compromises the comparability of studies. Clinical trials depend on consistent definitions of, quote, normal, quote, and, quote, abnormal, quote, to evaluate outcomes, determine safety thresholds, and assess treatment efficacy. When these definitions vary, so too does the interpretation of data. This not only weakens the strength of evidence, but also delays the translation of research into practice. In a field where time is often synonymous with survival, such delays carry profound consequences. From a clinical perspective, the implications are equally significant. Neonatologists and care teams rely on laboratory values to make critical decisions: when to intervene, when to observe, and how to tailor treatment plans for fragile infants. Without standardized reference ranges, there is an increased risk of both overtreatment and undertreatment. A value considered abnormal in one setting may be interpreted as acceptable in another, leading to inconsistencies in care that disproportionately affect vulnerable populations, particularly those in under-resourced or marginalized communities. This is where equity must be brought into the conversation with urgency and intention. The absence of standardized neonatal reference ranges does not exist in isolation. It intersects with broader systemic inequities in healthcare. Populations that are already underserved, racial and ethnic minorities, low-income families, and those with limited access to specialized neonatal care are more likely to be impacted by variability in clinical interpretation and treatment. If our goal is to achieve true maternal and infant health equity, we must ensure that the foundational tools of care, including laboratory standards, are both scientifically robust and equitably applied. In my work, I often speak about the importance of addressing disparities from the womb to the classroom. This philosophy is not simply aspirational. It is operational. It calls for alignment across sectors: healthcare, education, research, and policy, to ensure that every child is given a fair and healthy start in life. Standardizing neonatal laboratory reference ranges is a critical component of this alignment. It represents an opportunity to unify data, strengthen clinical decision-making, and ultimately improve outcomes for newborns across diverse populations. The path forward requires intentional collaboration. Researchers, clinicians, laboratorians, policymakers, and community advocates must come together to develop large-scale, diverse data sets that reflect the true variability of neonatal populations. This includes ensuring representation across gestational ages, racial and ethnic groups, geographic regions, and socioeconomic contexts. Advanced analytics and emerging technologies, including AI-driven modeling, can play a pivotal role in identifying patterns and establishing dynamic, context-sensitive reference ranges that evolve within the data. Equally important is the integration of lived experience into this work. As someone who carries both professional expertise and personal loss, I understand that data alone is not enough. We must listen to families, to NICU parents, to those who have navigated the uncertainty and complexity of neonatal care. Their insights provide a critical dimension that can inform more compassionate, responsive, and effective systems. Policy and regulatory frameworks must also evolve to support standardization efforts. This includes incentivizing data sharing across institutions, establishing guidelines for the development and validation of reference ranges, and ensuring that clinical trials adhere to consistent standards. Global collaboration will be essential as neonatal health challenges do not recognize national boundaries. Ultimately, addressing the lack of standardized laboratory reference ranges in neonatal trials is not merely a technical issue. It is a moral imperative. It is about ensuring that every newborn, regardless of where they are born or the circumstances into which they arrive, receives care that is informed, consistent, and equitable. It is about strengthening the integrity of our science so that it truly serves humanity. And for me, it is deeply personal. It is about honoring the life of my son, S.A.B.R.E.E., by committing myself to work that seeks to protect, uplift, and empower the lives of others. This is the work before us, and it is a work that demands not only our expertise, but our courage, our compassion, and our unwavering commitment to justice. I thank you for your valuable time. Blessings to you always and in all ways.